Okay. Okay. You need a handkerchief? Okay. Alright. Myocardial infarction, heart failure, valve disease. Okay? Take note about valve disease. There's only usually two types of valve disease. It can either be a stenosis or an atresia. Okay? Regurgitation as well. Sorry, 3 types. A stenosis means it's narrowed. Okay? The pathway of your blood through the valve has become narrowed. That's what you call stenosis. Mitral stenosis, pulmonic stenosis, aortic stenosis. It means the passageway has become narrowed. Now, when you say atresia, we're talking about blockage. When you say mitral atresia, the mitral valve is blocked. Okay? So stenosis is narrowing. Atresia is block or obstruction. Regurgitation, there's another one, right? Regurgitation, or spelled as regurgitation, right? I'm introducing you to these terms. If you're not familiar with regurgitation. Good thing I can spell better than I can draw. Okay. So regurgitation refers to, what does the valve do? Remember when the valve closes, what does it prevent? The backflow of blood. When there's regurgitation, the valve does not close completely because it is weak. And that causes backflow of blood back to the other chamber. For example, if you have aortic regurgitation, where does the blood flow back into? The left ventricle. Very good. Okay? Alright. Chronic lung diseases. Okay? Now, chronic lung diseases like what's this? Chronic obstructive pulmonary disease, bronchitis, emphysema, all of those things can affect the heart. Okay? Hyperthyroidism, infections. Note that in infections, okay, most of the time, when you guys have flu, notice that sometimes you actually feel your heart rate is faster, you're palpitating. When you have fever, you're palpitating, right? Because of an increased metabolic demand on your body. Okay, so this is what a premature beat looks like. So beat, beat, beat. It's not supposed to beat yet. This next P wave should be somewhere around here. But instead of coming here, it beats prematurely, seen here. The problem is, because the beat was premature, okay, note that the distance between here and the distance there is different. That's what you mean by an irregular RR interval. Okay, for ABCs. For atrial tachycardia, you're talking about a supraventricular rhythm originating in the atria. The rate is between 120 to 250 beats per minute. That is freaking fast. Okay? It's usually the result of digitalis toxicity, so we'll talk about digitalis some other time. And regular rhythms, usually there is an equal PP and equal RR intervals. Okay, P to P, R to R intervals are equal. And there's what's called a 1:1 conduction. What do you mean 1:1? 1 P wave, 1 QRS complex. Okay? Unlike with AV block, okay, unless with AV block. If an AV block occurs, then it becomes a 2:1 conduction. Sometimes there will be 2 P waves to 1 QRS complex. That in itself is already abnormal. Okay? Why would there be a 2:1? Because with an AV block, let me ask you. For example, if there is a block, okay, so this is the right, this is the left bundle. Let's say there is a block here at the right bundle, commonly known as a right bundle branch block. Will the depolarization still happen in the right ventricle? Yes or no?
No.
Yes.
Yes. Okay. Why? Because it's like this. My analogy is this. If you were to get from point A to point B on a smooth road, compared to getting from point A to point B, same distance on a rough road, which is faster? The smooth road. The conduction system is the smooth road. But if there's a detour, if there's road construction going on, if there's a roadblock, what should you do to get to point B? You turn around and you go into the rough road. That's how the heart works. If there is a block in the conduction system, the depolarization will go around it, but it won't be as fast. Okay? So in the case of an AV block, for example, if the AV block is here, when we say AV block, we're talking about AV node. If there is a block here, the signal will still pass. Unfortunately, it will be slower. So because there is an abnormality in the signal here, and because the pacemaker is firing at this rate, sometimes two contractions have already happened, but because the AV node is slow, only one will happen. That's what you mean by AV is normal. But if the AV node is normal, then it will be 1:1, no matter how fast the patient is. Okay, does everyone understand? Get to that point? Okay? And a short PR interval as I mentioned. Now, for atrial tachycardia, there's a different P-wave morphology. The QRS is unchanged, may occur in paroxysms. When you say paroxysms, it may occur suddenly or in bursts. It could occur for a few minutes and then stop. And then occurs again and then stops. Okay? And usually may terminate with a long pause before MSR matures. That's the problem with atrial tachycardia, that long pause. Why? Because that long pause means there is no electrical activity to the heart. Blood is not pumped out of the heart. Please note this. The first organ to always suffer from a loss of blood supply is what organ?
Brain.
The brain. Huh?
It's
Coma? Depends. Depends. There's many other. We'll talk about that in neurophysiology. Okay? But how long? Okay. By the way, you need to know this. Okay? The heart, the myocardial cell, can be deprived of oxygen for how long do you think? 45 minutes or too long? It's already dead in 45 minutes. A bit higher. A bit higher, not lower. 30 minutes too high. Go lower. 20 minutes. Okay? Take note. Myocardial cells can survive without oxygen for 20 minutes. But how long can neurons or brain cells survive without oxygen? How long do you think? 5 minutes, you're actually very close. It's 4. It's 4 minutes. If you deprive the brain of oxygen for 4 minutes, then brain cells will start to die. Okay? So the first organ always affected by long pauses is the brain. You're close. It won't cause coma. It will cause what's not as worse as coma. I heard it. Someone said it. It's simple.